4. Warning signs. You should never take magnesium. 5 signs you must take it daily. Magnesium, a mineral that is absolutely foundational to our well-being, plays a critical role in over 300 different biochemical reactions that occur within the human body every single day. It's a true workhorse, essential for everything from muscle and nerve function to energy production and even DNA synthesis. Yet, despite its vital importance, a significant portion of the population, with studies indicating that as many as 80% of people may not be getting enough of this crucial nutrient, are walking around deficient. This widespread deficiency is a concern in itself, but what truly raises alarm bells is the potential for harm when magnesium is taken incorrectly. Many individuals, often with the best intentions, fall into common traps that can lead to adverse effects. The risks are not to be taken lightly. They can range from developing serious kidney problems, experiencing breathing difficulties, to even facing dangerous heart complications. This pervasive issue stems from a misunderstanding of when and how to supplement with magnesium, leading some to take it when it's contraindicated or to combine it with medications that can trigger harmful interactions. It is precisely these preventable mistakes that I aim to address today. This comprehensive guide will equip you with all the essential knowledge about magnesium supplements, covering the beneficial aspects, the potential pitfalls, and most importantly, the safe and effective ways to incorporate them into your routine. By the time we conclude, you will possess a clear understanding of who truly needs magnesium supplementation, who should steer clear of it, the appropriate dosages to consider, and the critical warning signs to watch out for. Let us embark on this journey to demystify magnesium and ensure its use enhances your health rather than jeopardizing it. The first fundamental question that requires an answer is, do you actually need magnesium supplements? It's a question many people overlook, blindly taking magnesium without first assessing their genuine need. Fortunately, there are discernible signs your body exhibits when it's signaling a deficiency. The most prominent indicators often manifest as muscle-related issues. Consider those sudden, excruciating calf cramps that jolt you awake in the dead of night, or the persistent, uncontrollable twitching of your eyelid. These are not mere annoyances. They can be direct pleas from your body for more magnesium. Magnesium acts as a natural regulator for your nervous system, akin to a volume knob for nerve signals. When its levels are insufficient, your nerves can become overstimulated, analogous to exposed electrical wires that cannot be switched off. This overexcitement translates into muscle cramps, involuntary twitches, a loss of sensation, numbness, and those unsettling tingling sensations that often occur in the extremities, such as your hands and feet. Beyond mere cramping, have you noticed a decline in your leg strength, making even simple walks feel arduous? Do you struggle to muster the physical power you once possessed? Magnesium is intrinsically linked to the energy production within your muscles. Without adequate magnesium, your muscles are deprived of the fuel they need to function optimally, leading to weakness and fatigue. The second major category of individuals who frequently exhibit signs of magnesium deficiency are those experiencing stress and emotional disturbances. It might come as a surprise to learn that stress is not solely a mental phenomenon. It profoundly impacts your body's magnesium reserves. This creates a detrimental feedback loop that many remain unaware they are caught in. When you are under stress, your body instinctively enters a fight or flight mode. Your sympathetic nervous system becomes hyperactive, prompting your body to demand greater quantities of magnesium to cope with the elevated stress response. Simultaneously, stress hormones such as cortisol and adrenaline actively encourage your kidneys to excrete magnesium through urine. Consequently, stress depletes your magnesium stores, and a lack of magnesium, in turn, exacerbates your susceptibility to stress. It's a predicament akin to being trapped in quicksand. The more you struggle, the deeper you sink. If you find yourself battling feelings of anxiety, heightened irritability, or are plagued by a racing mind that prevents you from sleeping, magnesium might just be the missing component in restoring your emotional equilibrium. The third demographic that typically requires increased magnesium intake consists of older adults. As individuals age, their digestive systems naturally become less efficient. The production of stomach acid diminishes, which is crucial for the proper dissolution of magnesium from food. Furthermore, the intestine's capacity to absorb nutrients declines. This means that even if magnesium is adequately dissolved, a smaller amount is successfully transferred into the bloodstream. Compounding this issue is the tendency for many older adults to consume fewer magnesium-rich foods, such as dark leafy greens, whole grains, and nuts. This reduced intake can be attributed to chewing and digestive difficulties, or simply a decreased appetite. This dual challenge of impaired absorption and reduced dietary intake makes magnesium deficiency a particularly prevalent concern for individuals over the age of 60. Moreover, those who suffer from digestive ailments like acid reflux, irritable bowel syndrome, IBS, or inflammatory bowel disease, IBD, are also at a significantly elevated risk of magnesium deficiency. These conditions disrupt the body's inherent ability to absorb nutrients effectively, including magnesium. The fourth group to consider are individuals who are prescribed certain common medications. If you are taking diuretics, often referred to as water pills, which are commonly prescribed for managing high blood pressure and various heart conditions, it is imperative to pay close attention to your magnesium levels. The mechanism by which these medications function involves increasing urine production. However, they do not selectively remove only excess water. They also indiscriminately flush out magnesium, potentially leading to a deficiency. A similar risk exists for those using acid-blocking medications, specifically proton pump inhibitors, PPIs. If you are taking drugs like omeprazole or lansoprazole to alleviate symptoms of heartburn or treat ulcers, you are inadvertently reducing the stomach acid necessary for optimal magnesium absorption. Over an extended period, this can result in a magnesium deficiency, even if your diet is rich in magnesium-containing foods. The fifth group that often benefits from supplementary magnesium includes individuals diagnosed with diabetes. Here's a closer look at the complex interplay. When blood sugar levels are elevated, your kidneys work overtime to excrete the excess glucose through your urine. Unfortunately, magnesium is inadvertently swept out along with the sugar. To exacerbate matters, when you administer insulin, it not only facilitates the movement of sugar into your cells, but also draws magnesium along with it. This process can lead to a temporary decrease in blood magnesium levels. Given that magnesium plays a crucial role in the proper functioning of insulin, a deficiency can, in turn, worsen blood sugar control, creating yet another detrimental cycle. However, a critical caveat exists for those with diabetic kidney disease. Compromised kidneys struggle to efficiently eliminate excess magnesium, rendering supplementation potentially hazardous. Therefore, it is absolutely essential to consult with your healthcare provider before considering magnesium supplements if you have any form of kidney impairment. Additionally, individuals who consume alcohol regularly often require a higher magnesium intake. Alcohol significantly impedes magnesium absorption in the intestines and also accelerates its excretion through the kidneys. Even moderate, consistent alcohol consumption can gradually deplete your body's magnesium stores over time. Furthermore, individuals engaged in strenuous physical activity or those who work in hot environments are prone to losing substantial amounts of magnesium through perspiration. If your occupation involves manual labor in the heat, if you are a dedicated athlete, or simply if you sweat profusely on a regular basis, you are actively losing magnesium through your skin. Finally, for those managing high blood pressure, magnesium supplementation may offer a beneficial effect. Magnesium functions as a natural vasodilator, meaning it helps to relax the blood vessels. When your arteries and veins are more relaxed, blood can circulate more freely, thereby reducing the overall pressure on your cardiovascular system. Adding another layer to the pervasive Need for magnesium in modern society. A significant factor for most individuals residing in industrialized nations is the depletion of magnesium content in our soil due to contemporary agricultural practices. This agricultural reality means that the foods we consume today inherently contain substantially less magnesium compared to their counterparts from 50 years ago. If your dietary habits do not regularly incorporate nutrient-dense foods such as dark leafy greens, whole grains, an assortment of nuts, seeds, and legumes, it is highly probable that you are not meeting your magnesium requirements through food alone. For the average healthy adult, a daily intake of 100 to 200 milligrams mg of magnesium from supplements is generally considered safe and likely to offer benefits. If you are experiencing clear symptoms of a deficiency, a higher dose might be necessary, but it is strongly advised not to exceed 350 mg per day from supplements without the guidance and supervision of a qualified healthcare professional. Now, let us delve into the crucial aspect of choosing the right forms of magnesium supplements, as their efficacy and how they are absorbed can vary dramatically. It is a common misconception that all magnesium supplements are created equal, which is far from the truth. Among the highly recommended and well-absorbed forms are magnesium glycinate and magnesium malate. These formulations are known for their excellent bioavailability and are typically gentle on the digestive system, minimizing the risk of gastrointestinal discomfort. Conversely, magnesium oxide is a form that should generally be avoided unless your specific objective is to alleviate constipation. Its absorption rate is notoriously poor, and it tends to act more as a laxative than a true nutritional supplement, offering minimal systemic benefits. Having explored who might benefit from magnesium, it is equally important to identify those who should unequivocally avoid magnesium supplements. There are distinct groups of individuals for whom taking magnesium can pose significant health risks. The primary group that must completely refrain from magnesium supplementation are individuals with any form of kidney problem. The kidneys play an indispensable role in regulating the body's magnesium balance by filtering out excess amounts. When kidney function is compromised, the body's ability to excrete surplus magnesium is impaired. This can lead to a dangerous accumulation of magnesium in the bloodstream, a condition known as hypermagnesemia. The initial symptoms of magnesium toxicity can be subtle, manifesting as nausea, vomiting, and diarrhea. However, as magnesium levels continue to climb, more severe manifestations can emerge, including profound muscle weakness, a precipitous drop in blood pressure, hypotension, significant difficulty in breathing, and irregular heart rhythms. In the most critical and severe instances, unchecked hypermagnesemia can lead to cardiac arrest, meaning the heart stops beating altogether. Allow me to illustrate this with the case of Margaret, a 72-year-old woman who had been diagnosed with mild kidney disease. She had been experiencing persistent issues with constipation and had read online about the potential benefits of magnesium for this condition. Unfortunately, she was unaware that her compromised kidneys were incapable of effectively clearing excess magnesium from her system. After just 5 days of taking a magnesium supplement, she began to feel unwell, experiencing nausea and an unusual sense of fatigue. Initially, she attributed these symptoms to an impending flu. However, her daughter, concerned by her mother's worsening condition, insisted on taking her to the doctor. Upon conducting blood tests, the medical team discovered dangerously elevated levels of magnesium in Margaret's blood. She required hospitalization to undergo treatment to remove the excess magnesium from her system and restore her biochemical balance. This case underscores the critical importance of understanding your kidney health before considering magnesium supplementation. If you have any degree of kidney disease, ranging from mild impairment to complete kidney failure, it is absolutely imperative that you do not take magnesium supplements without the direct and explicit supervision of a medical professional. The second group who should exercise extreme caution or avoid magnesium supplements entirely are individuals who already experience very very low blood pressure, a condition known as hypotension. Magnesium exerts a vasodilatory effect, meaning it relaxes and widens the blood vessels, which naturally contributes to lowering blood pressure. For individuals whose blood pressure is already at a low baseline, introducing magnesium can cause it to plummet to dangerously low levels. This drastic reduction can trigger a cascade of concerning symptoms, including intense dizziness, fainting spells, and an increased risk of falls, which is a particularly grave concern for older adults who are more vulnerable to fractures and other injuries from falls. Let me share the experience of Robert, a 69-year-old retiree whose blood pressure was already on the lower side, typically hovering around 165 mmHg. He decided to start taking magnesium, having heard it was beneficial for alleviating muscle cramps. However, on the third day of his supplementation regimen, as he stood up from his morning coffee, he was immediately overcome by a sensation of the room spinning. He managed to grab onto the kitchen counter just in time to prevent himself from falling. His wife, alarmed by his sudden episode, took his blood pressure and discovered it had dropped to a critically low 85-55 millilmho. Upon contacting his doctor and mentioning the new magnesium supplement he had started, the doctor unequivocally instructed him to discontinue it immediately. Within a mere 2 days of stopping the magnesium, Robert's blood pressure gradually returned to its normal range, and the dizzy spells completely disappeared. This experience highlights the profound impact magnesium can have on blood pressure regulation in susceptible individuals. The third group includes individuals who suffer from a slow heart rate, a condition known as bradycardia, or have certain heart rhythm disorders, such as heart block. In these cases, magnesium supplements can potentially exacerbate the existing condition. Magnesium has the capacity to further slow down the electrical signals that regulate the heart's rhythm. This could lead to severe arrhythmias, which are irregular heartbeats, or, in the most extreme and dangerous scenarios, could precipitate cardiac arrest. Consider the situation of Frank, a 75-year-old gentleman who already possessed a naturally slow heart rate, averaging around 55 beats per minute. His physician was aware of this and was monitoring it, but it was not considered severe enough at that time to warrant any specific medical intervention. Frank, however, had read about the purported benefits of magnesium for improving sleep quality and decided to begin taking a magnesium supplement. Within a week of starting the supplement, he began to notice an unusual feeling of weakness during his regular daily walks. When he attended his routine medical checkup, his doctor discovered that his heart rate had significantly decreased, dropping to an alarming 42 beats per minute. The magnesium supplement was identified as the culprit, further slowing his already slow heart. His doctor promptly discontinued the magnesium supplement, and Frank's heart rate gradually returned to its previous baseline level. This case serves as a stark reminder that individuals with pre-existing cardiac conditions must be extremely cautious with magnesium supplementation. The fourth group encompasses individuals who are currently taking certain medications. Magnesium has the potential to engage in significant interactions with a wide array of pharmaceutical drugs, necessitating careful consideration and medical consultation. For instance, when taken concurrently with certain antibiotics, such as tetracyclines and fluoroquinolones, magnesium can bind to these medications within the stomach. This binding action impedes their absorption into the bloodstream, thereby diminishing their effectiveness in fighting infections. To mitigate this interaction, it is crucial to ensure a time separation of at least 2 hours between taking magnesium supplements and these particular antibiotics. Linda's story provides a perfect illustration of this scenario. She had been prescribed antibiotics to treat a urinary tract infection. Unbeknownst to her, she had been consistently taking her magnesium supplement along with her breakfast every morning for several months prior. What she failed to realize was that the magnesium was actively preventing her antibiotic from being properly absorbed. Despite completing the full course of prescribed antibiotics, her Infection showed no signs of clearing. When she consulted her pharmacist, who inquired about all the supplements she was taking, the interaction was immediately identified as the probable cause of the treatment failure. Another critical category of drug interactions involves muscle relaxants. Since magnesium possesses inherent muscle relaxing properties, combining it with prescription muscle relaxants can lead to a dangerous synergistic effect, potentially causing a significant drop in both blood pressure and heart rate. Furthermore, individuals taking cardiac glycosides, a class of drugs commonly used to manage heart failure, such as digoxin, must also exercise extreme caution. These medications, like digoxin, are designed to strengthen the heart's contractions and help regulate its rhythm. However, when magnesium is ingested concurrently with these drugs, it can alter how the digoxin is absorbed and utilized by the body. This alteration can lead to unpredictable effects, potentially reducing the drug's efficacy, or conversely, increasing the risk of adverse side effects, including dangerous heart rhythm problems. Consider the case of Dorothy, an 81-year-old woman who was prescribed digoxin to manage her heart condition. Her digoxin levels had been meticulously monitored and maintained at a stable therapeutic range for many years. However, when she began incorporating a magnesium supplement into her daily routine to address leg cramps, her subsequent blood tests revealed a concerning unpredictability in her digoxin levels. On some days, the levels were too low to be effective, while on other days, they spiked to potentially toxic levels. Her cardiologist had to dedicate several weeks to carefully recalibrating her medication dosage until it was determined that the magnesium supplement was the root cause of this instability. Once they were able to coordinate the timing of her magnesium supplementation with her digoxin medication, her heart medication became stable once again. Now it is time to address the critical rules and guidelines for taking magnesium supplements in a manner that is both safe and maximally effective. Firstly, it is imperative to exercise caution when combining magnesium supplementation with high-dose vitamin D supplements. While it is true that magnesium plays an essential role in enabling your body to utilize vitamin D efficiently, the inverse can also be true. Consuming excessively large amounts of vitamin D, specifically exceeding 4,000 international units, IUs, per day, can actually lead to a depletion of your body's magnesium stores. Therefore, if you are taking high-dose vitamin D, it is essential to ensure that you are also obtaining an adequate intake of magnesium. However, do not fall into the trap of assuming that simply taking more of either supplement is always better. Balance is key. Secondly, it is crucial to understand that standard blood tests can often be misleading when it comes to assessing your magnesium status. This is because only a very small fraction, approximately 1% of your body's total magnesium, is found circulating in your blood. The vast majority of magnesium is stored within your bones, muscles, and cells, where it is not readily detectable by typical blood work. Your body is remarkably adept at maintaining stable blood magnesium levels, even if you are deficient in other tissues. This physiological mechanism means that you could have seemingly normal blood magnesium levels on a test, yet still be experiencing a significant deficiency in the very places where it is needed most for optimal function. Instead of relying solely on blood tests, it is far more practical and informative to pay close attention to the physical and emotional symptoms I have already discussed, such as muscle twitching, weakness, numbness, or tingling in the hands and feet, heart palpitations, feelings of anxiety, poor sleep quality, and persistent fatigue. Thirdly, it is vital to be mindful of the delicate balance between calcium and magnesium intake. If you are in the habit of taking calcium supplements without concurrently ensuring adequate magnesium intake, you may inadvertently be setting yourself up for potential health problems. Without sufficient magnesium to help regulate its use, excess calcium can be deposited in inappropriate areas of the body, potentially contributing to the formation of kidney stones and accelerating the hardening of your arteries, a condition known as atherosclerosis. A generally recommended and healthy ratio for most individuals is approximately 2 parts calcium to 1 part magnesium. Fourthly, it is important to be aware of the impact of your caffeine and alcohol consumption. Both of these common substances have been shown to increase the amount of magnesium that your kidneys excrete. If you are a regular consumer of coffee or enjoy alcoholic beverages with any frequency, you will likely need to be more diligent and consistent with your magnesium supplementation to effectively counteract these increased losses and maintain adequate levels within your body. Fifthly, and this is a crucial point for digestive comfort and absorption, do not consume large doses of magnesium on an empty stomach. This practice is a direct pathway to gastrointestinal distress, which can manifest as diarrhea, stomach cramps, and nausea. Instead, a far more effective and comfortable approach is to divide your daily magnesium dose throughout the day and take each portion with meals. This strategy not only significantly reduces the likelihood of experiencing unpleasant side effects, but also, rather counterintuitively, actually enhances the absorption of magnesium into your system. Here is the proper and most advisable method to initiate magnesium supplementation. Begin by starting with a low dose, generally around 100 milligrams per day, and take it with your evening meal. This approach allows your body ample time to adjust and for you to gauge its response without overwhelming your digestive system. If you tolerate this initial dose well after approximately a week, you can then gradually increase your intake to 200 milligrams per day, splitting this dose between your morning and evening meals. For optimal absorption and to minimize the risk of side effects, it is highly recommended to choose magnesium glycinate or magnesium malate. Ensure that you take each dose with a meal that contains some healthy fats, as these can further enhance magnesium absorption. Conversely, it is advisable to avoid taking magnesium supplements with meals that are exceptionally high in fiber or with high fiber drinks, as the fiber content can interfere with the absorption process. It is essential to remember that the effectiveness of magnesium supplementation is amplified when it is integrated into a holistic approach to a healthy lifestyle. No single supplement, however beneficial, can compensate for a diet consisting predominantly of processed foods, excessive sugar intake, or prolonged exposure to chronic stress. Therefore, it is most constructive to view magnesium supplementation as one vital piece of your overall health puzzle, rather than a miraculous cure-all that will single-handedly resolve all your health concerns. Now the floor is yours. Have you experienced any of the telltale signs of magnesium deficiency that we have discussed today? Or perhaps you have lingering questions or concerns about whether magnesium supplementation is the right course of action for your specific circumstances. I encourage you to share your thoughts, questions, and personal experiences in the comments section below. Thank you for taking the time to watch this video. If you found this information valuable in enhancing your understanding of magnesium and in helping you to avoid potentially serious mistakes, please consider hitting the like button, sharing this video with your friends and family members, and subscribing to Better Life. Our unwavering commitment is to provide you with health information that is not only scientifically validated and evidence-based, but also practical, safe, and easily digestible for your everyday use.